again, gluten's number one.
My goal today is to tweak, if not change, your paradigm about nutrition therapy, and that is those of you who see patients who might benefit from a change in diet. I have no conflicts to announce. And start off by saying Albert Einstein defined insanity as performing the same ineffective measure over and over again, expecting a different result. The nutrition community, for the 30 years that I've been in practice, has been basically saying the same message. The only thing that's changed is the messengers. If you don't believe me, just turn on The Biggest Loser, and you'll see pretty much the same message that we've always preached for years. Eat 5 servings of fruits and vegetables a day or more. Eat lean protein and meats. Avoid simple sugars, and exercise every day. Now, it may be insane, but it's not a bad message. But the problem is 95% of people won't do that, or they don't do that. So continuing to offer that as a remedy for these patients that you're seeing just isn't working. So I hope to give you a little bit of paradigm shift between medical nutrition therapy and weight loss or obesity treatment. They're really quite different, and what a paradigm shift is, and I want to say that one more time, weight loss or obesity treatment versus medical nutrition therapy. And when I look for a paradigm shift, I look for those of you out in the audience who go, you know, what the hell is he talking about? And that's a good thing, because at least I have your attention. Now, medical nutrition therapy is treating symptoms and disease with nutritional strategies. Let me say that again, because paradigms are hard to change. Treating symptoms and disease with nutritional strategies. One more time, treating symptoms and disease with nutritional strategies. Where do you see the word weight loss? Where do you see the word obesity? You don't. And yet, the 36-year-old woman who walks in and says, why are you here? I need to lose weight. 9 times out of 10, we get lost in the paradigm. So to be a credible therapy, whether it's a pill or nutrition, it has to be safe and it has to be effective. So what is effective nutrition therapy? First of all, it needs to produce consistent, predictable results. It needs to be adaptable to individual needs and preferences. And most importantly to me, you need to be able to teach individuals to use food to manipulate physiology to slow, stop, or reverse disease and aging. Produce consistent, predictable results. Now, if anybody's applied dieting to their patients, you'll know that one thing you don't get is consistent, predictable results, depending on what you're measuring. And to teach individuals to manipulate physiology, what the hell am I talking about? Well, I'm talking about the fact that they make a change, they perceive and measure a clinical difference, then they know how to do that again. Pretty simple. I'll digress for a moment and talk about some general concepts, because this is really where the message went wrong. To do anything successfully, at least as far as scientific principles, we have 3 applications. You have to have the intention of what you're trying to do. You have to have the science behind that intention. Does it exist? Is it doable? Is the technology available? The application, which means the method that you're going to use to put the science together and achieve a result. And then you have to have the insight and the imagination to understand what your intention is, what the science is, and the application. And then can you imagine yourself doing that? John Kennedy flew us to the moon from 1961, got us to the moon in 1970. And he said, I want to get to the moon in 9 years. Everybody went, you're crazy. That was his intention. Did the science exist? He already looked up what the physics were, what the technology was, what the infrastructure was, what new applications needed to be developed, and what systems needed to be brought together in that application. Got everybody to have the insight that it could be done, and then the imagination to actually do it. It wasn't an easy task. He did it. This is no different. Sometimes effective nutrition therapy is harder than flying to the moon, it seems. So the 36-year-old walks in and she says, I want to lose weight. Well, what's her intention? Is it her appearance? Is it to decrease symptoms? Well, she sits down and I go, well, why are you here? Well, I just don't look good. And so I say, well, you're not, what, sexually attractive? Well, yeah, I don't feel good about myself. I'm not sexually attractive. So your husband's not attracted to you? Well, no, he likes me no matter how I am. He seems to be after me all the time. So are you want to attract other men? No, that's not it. Well, let's see. So, but my friends are all thin, and so they're ostracized. So they're kicking you out of the group? No, they're pretty good friends. You could spend hours going in this direction and never get anywhere because there's no definition. I saw a sexy person today, and she wasn't that attractive. I saw an attractive person today, she wasn't that sexy. You can't measure it. Now, somebody walks in, they say, I'm fatigued, 0 to 10. 0, no energy, 10, you're all energetic. Self, where are you? 8. I can tell you instantly within a nanosecond where the fatigue is, where the depression is, how much the joints hurt, how bad their acid reflux is. Every single time, and tell you in a week if it's down by X percentage points. Every single time. Why do we need to understand the science, both us, the provider, and the patient? Because we need to cooperate. And to cooperate, we need to believe that what we're doing is actually accurate. So the science is very important. Very difficult science in my particular field, but it's important. And then the application. And to apply these things to get a result is a journey. And especially in nutrition therapy, it's a lifelong journey. You're aging, you have illness, you move, you have social and stressful things that happen to your life. All kind of different things come and interrupt your normal lifestyle. So the application of the method, how you're accounting for it, when it's implemented, that's a journey. So the individual needs to understand what their intention is, what tools are available scientifically, and how to apply that over time. And that really takes some imagination in an individual case. And I try and get my patients, each one and everyone, to do this. So number one, there are 3 paradigms that have changed in my practice, in my professional life, completely. Number one is patients don't really care about weight loss. They don't really care about weight loss. If you ask them those few questions I was telling you about appearance, you'll find out right away. They really care about how they feel and function, though, and over the long haul, that's extremely important. Secondly, second paradigm, patients return to what works. And in my clinic, most of our long-term business is patients who understand consciously or intuitively the dietary strategies will regain, notice the word regain, control of the symptoms of disease. Why? Because they're going to fall off the wagon, they're going to splurge, they're going to have life crises, and the symptoms will relapse. And when they go back on their strategy, the symptoms disappear again over and over again. They come to expect improvement, and their experience has taught them it will be relatively rapid, which I'll talk about in a minute. So when do you see them again? After they splurge a little too long or a little too much.